Good afternoon, everyone. I'm Diana Rowe, CEO of Pima Medical Center, and I wanted to thank you for joining me today. I wanted to talk to you about something that's at the core of our mission statement, which is compassion in healthcare delivery. Compassion is not just a nice to have, it's a must have. We want the folks from our community that are visiting our facility to remember us long afterwards in a positive manner. We want to meet them at their level with their personal needs, and we want to show our respect and to provide dignity in their care, to provide patient centered technologies that will help them from start to finish. Whether it's, and thank you, by the way, IT folks, for helping our patients get online, get into the portals to access their private healthcare information. And thank you for our healthcare teams for showing that empathy and compassion. And you'll hear me say that word a lot, empathy. It's our E word. We want to make sure that compassion is at the core of everything that we do, including listening to our patients. We want to make sure that we're using our active listening skills in everything that we deal with our patients because it builds a level of trust when you listen to them. They're at their most vulnerable. They're anxious, they're scared, they're in pain, and sometimes they're in moments where they're hopeful, like bringing a new life into the world. We want to respect their cultures and their differences and embrace those in their care and to incorporate their family members in their care, as well as their physicians that are satellite from our facility, and bring them all together under one umbrella, if you will. So I want you to continue to show those things. And I mean, they might be a small gesture. You may think it's a small gesture, but in those brief moments, you should show that smile, share those words of encouragement, use that gentle touch, use those times to embrace the situation, to live in that moment, to show that we're not just about the day to day procedures and daily tasks that we tend to kind of become robotic at, and we want to interject our personalities and our compassion in those moments. We want to also make sure that the folks in our community that, they feel support and that we also offer each other support. We want to cultivate a work environment where we're supporting each other. We have rough days too, and we want to make sure that you look for that colleague who might be struggling and provide words of encouragement. I've had rough days myself, and it's great when I see an email from one of you letting me know some of the positive things that we're doing in our community and some of the positive outcomes we have in our healthcare. It can't always be about the problems. We want to bring solutions for each other to whether it's streamlining processes or making our facility more comfortable for ourselves and for the patients that come into our facility. And we can do that through innovation, like our portals where they're accessing their information, or through different types of scheduling reminders. Thank you, scheduling team, for handling all of that for us. Also, we want to make sure that we are all on the same page with our commitment to compassion. I'm very proud to be leading here at Pima Medical Center, and I hope that you also take pride in the care that you give. I believe you do. I see it every day in your faces. I see it in the faces of our patients when they come in and have to have some awful ordeal that they're struggling with in their life. And we meet them there with that E word, that empathy. Thank you again for your time. Thank you for just tackling those tough moments and showing that it's not just about work ethic and procedures, it's about caring for the person, not just their condition. I hope you have a great rest of your day.